lastly, I would like to talk about the different types of basal cell carcinomas. You actually do get a few more, but I'm just going to touch on the most important ones. The first one is the most common. It involves typically about 50% of all of the basal cell carcinomas, and that is your nodular basal cell carcinoma, or otherwise known as rodent's disease. It's unbelievable how nodular basal cell carcinoma can eat away a nose, an ear, or an eyelid. Secondly, you get your superficial spreading or multicentric basal cell carcinoma. These basal cells are more common on the trunk, but yes, you also get them on the face and ears. Interestingly enough, what is interesting about basal cell or superficial basal cell carcinoma is the fact that it can range from only a few millimeters to quite a few centimeters. They can be humongous. Thirdly, you get a cystic basal cell carcinoma. Cystic basal cell carcinoma looks quite similar to your nodular basal cell carcinoma. Fourth, you get your pigmented basal cell carcinoma. Now, pigmented basal cell carcinoma can be a tricky one because that type of basal cell carcinoma can mimic a melanoma. Now again, the treatment stays the same. You still need to surgically remove it, but again, it can be a bit of a surprise if you think that you're removing a melanoma and it actually is a pigmented basal cell, or vice versa. And then you get your morphiform basal cell carcinoma. This is a melanoma that is typically ivory in color compared to the red type of basal cells that you get. So morphiform is ivory in color, and they've got a very high reoccurrence rate after treatment. So if you have a morphiform basal cell carcinoma, you definitely need to always remember about the possibility of reoccurrence. And then the last one, and the most aggressive, and that is your infiltrating or micronodular basal cell carcinomas. Now, this type of cancer or basal cell cancer is notorious for their destructive and aggressive behavior, and especially their subclinical spread. You might think that, this basal cell cancer is gone, but unfortunately, subclinically, it is spreading. And then, of course, also remembering that it does have a very high reoccurrence rate.